If you love, then let go. Surely many of you have heard this hackneyed expression dozens of times in soap operas. But are these words so fair when it comes to the death of a loved one? Is it possible to accept the departure of a loved one if he is physically healthy, relying on the fact that everyone has the right to make a choice from birth? And if this choice belongs to a minor who, due to age, has not yet formed his picture of life, or a person with mental disorders? From the point of view of ethics and morality, is it the right decision to give such people the right to choose in the matter of life and death, and if this is a completely conscious decision of a person who is brought only unbearable mental pain every day, which even pills cannot drown out? These questions can be asked endlessly, and everyone perhaps will answer them in their own way. The fate of a 17-year-old girl from the Netherlands and Pothoven in the early summer of 2019 shook the world to the core. I breathe, but I don't live. That's what Noa wrote before she stopped eating and drinking. She died under the close supervision of doctors from dehydration and hunger. At the age of 11, she experienced sexual harassment for the first time and was raped at the age of 14. The girl did not tell anyone about it for a long time, ashamed of what happened. Since then, Noa has suffered from post-traumatic stress disorder, depression, and anorexia. I experience fear, pain every day. Always scared, always on guard. To this day, my body is still dirty. There was a destruction of my house, my body. It can't be undone or forgotten, Noa said. After learning about everything, the parents persuaded the girl to go to the police and go to the clinic. This, she said, was an additional stress for her. The treatment didn't help, and the wandering began in hospitals, where the girl spent the last years of her life. Well, she told about her life in the autobiographical book, To Win or Learn, published in 2018 year. I was so young when it started. I was only 11 years old. I was a perfectionist, and everything that was difficult for me, and I tried to do better than others. Then everything was fine. Before I was rudely touched. Survival. I felt like a criminal, although I had never stolen a single candy from a store in my life, Pothoven wrote. One of the medical institutions where she was placed to prevent suicide, she called a real hell. According to the girl's mother, hospitalization in another hospital, where they are treated for anorexia, had to wait 6 months. Because of this, Pothoven had to eat through an umbrella. In the Netherlands, there is no place where her mental and physical problems can be solved, her mother said. But in the 2018 year, for the first time, with a request for euthanasia, but Potvina turned to one of the clinics in The Hague. In the 2018 year, without the knowledge of her parents, the girl was refused. I was told that I was too young to die, she told one Dutch publication. Although she was admitted to a psychiatric hospital 21 times from the point of view of the law, but she was recognized as sane and capable. A year before the events described, she had already stopped eating and drinking. Then she was put into an artificial coma and fed artificially. However, at the age of 17, she could make an independent legal decision to get everyone behind her. After several court decisions and long discussions, the Netherlands lowered the age limit for euthanasia until the age of 12. Now any terminally ill child can make such a shocking request to the Ethics Commission. Only up to the age of 16, he will need to get the consent of his parents for this step. Then everything depends only on him. But Noa did not fit the category of a teenager in need of euthanasia, because she did not suffer from a deadly disease. And according to mental indications, such manipulation should be performed from the age of 21. But the girl didn't want to wait. Noa described to the clinic where she was being treated. According to her stories, it becomes clear how terrible it is when the treatment is scarier than the disease itself. The system of providing psychological assistance to adolescents in the Netherlands is also far from ideal. Sometimes social workers can only listen and regret, but this is not enough. In the West, it is a fairly common practice to seek help from a psychotherapist. This is a certified specialist who will always listen, give the necessary advice, always calm, courteous, and tactful. And of course, he is tolerant, because every person is a person, with his own views on life and inalienable rights, beyond the personal boundaries of which in any case it is impossible to cross, thereby not offending him. But is this method of exceptional gingerbread suitable for everyone, in which only approving parting words reign? Maybe a person needs a portion of sobering truth, after hearing which he will at least think. And is his life really so terrible? And how to find this fine line between restriction in the name of salvation and freedom of choice? One of the psychologists suggested that Noa write a book about what happened to her. He thought it would distract her from her bad thoughts. The book became a sensation. She has received several literary awards. Everyone recognized it. And she herself was even more confirmed in her choice. 10 weeks before his death, Noa's book won 2 prizes at once. In particular, as the best work in the genre of nonfiction. She said that she wanted her book to help victims of violence like her, who were forced to fight for their lives. In her Instagram, deleted 2 days after her death, she wrote that the decision was deliberate. The sad last post, I was doubtful that I could write it, but I decided to do it. I've been planning this for a long time. My decision is not at all impulsive. I'll get right to the point. I'll be dead in 10 days at most. I stopped eating and drinking. And so, after a lot of talking, I decided to get rid of it. My suffering is unbearable. I don't live, and I survive. And even though I'm still breathing, I've been dead inside for a long time. I am well cared for, I get strong medications, and spend the whole day with my family. I'm lying on the bed in the living room. This is how I say goodbye to the most important people in my life. It's all right. Don't convince me that this is wrong. This is my decision, and it's final. In this case, to love means to let go. Well, Pothoven died on the 2nd of June, 2000 of the 19th year, a few days after refusing to take food and water. Parents and doctors agreed not to feed her, but against their will and not to force her to treatment. All that the doctors did was not to prevent the girl's voluntary refusal to continue life. But to what extent was this the only way out? Legally, but was not subjected to the procedure of euthanasia. She refused water and food with the connivance of her parents, close people, doctors. But this is a painful and far from the most humane care. On the 26th of January, 2018, a similar story has already taken place in the Netherlands. 29-year-old Dutch Aurelia Brouwers, who suffered from a mental disorder, but at the same time completely healthy physically, was euthanized at her own request. I am 29 years old, and I voluntarily decided on euthanasia. I decided so because I suffer from mental disorders. My life is unbearable. Every breath is torture. Mental illness, depression appeared in Aurelia Brouwers when she was 12 years old. The doctors said I had borderline personality disorder. Then other diagnoses appeared. Attachment disorder and chronic depression, chronic suicide, anxiety, psychosis, she recalled. Aurelia Brouwers repeatedly tried to commit suicide. I've tried maybe 20 times. Several times I almost succeeded. But, as the doctors said, I have extremely strong lungs and heart. It's a miracle that she survived, they said about her. Aurelia's doctors were categorically against euthanasia. Then she went to the Levinson Clinic of the End of Life Clinic in The Hague. The last resort for those whose desire to die was not supported by the attending psychiatrist or therapist. Of the 83 patients who achieved euthanasia for psychiatric reasons, 65 died in this clinic. However, it was not so easy to get permission. Since 2002, the clinic has approved only 10% of petitions, and Aurelia has been fighting for her right to die for 8 long years. Journalists of the Dutch TV channel Full News spent the last weeks of her life with the girl. One by one, she crossed out the days remaining before euthanasia from the calendar. Aurelia chose January 26, 2018, as the day of her death. The film crew accompanied the girl everywhere when she rode a bicycle around her beloved city of Deventer, did needlework, and had dinner with loved ones. And one day Aurelia went to the crematorium, which she chose as the last point of her journey. Her mood changed a lot during the day. It was felt that something was oppressing her. She couldn't talk coherently about anything. It was only when we talked about euthanasia that she formulated her thoughts clearly. Journalist Ander Paulus recalls the time spent with Aurelia. However, does clarity of thought mean that Aurelia was aware that she chooses death instead of life? After all, according to the Dutch law on euthanasia, the doctor should have no doubt that the patient has considered his decision well and understands the consequences. Maybe Aurelia's desire to die was just a symptom of her numerous mental illnesses. People with borderline personality disorder tend to self-destruct. They can injure themselves, suffer from fits of rage, have difficulty maintaining relationships, and are emotionally unstable. Attachment disorder is also often accompanied by aggression directed against oneself. Keith Van Mechelen, a psychiatrist at the Levenside Clinic, is convinced that it is impossible to know for sure. First of all, you need to do everything to reduce the symptoms. With personality disorders, the desire to die is not uncommon. And if the patient has been treated, his desire to die should be considered as the desire of a cancer patient who says, "I don't want to go to the end." However, not all Dutch psychiatrists agree with her. How do we know that the desire to die was not a sign of Aurelia's mental illness? The fact that someone has found a logical explanation does not mean that the desire to die is not related to the disease, says Dr. Frank Kerselman, one of the most ardent critics of euthanasia of mentally ill people. He is convinced that psychiatrists should not be led by clients. You cannot get infected with their hopelessness. Let people have lost hope. But the doctor should be there and instill it. Patients need to know that you will fight for them, he says. On the eve of her death, her favorite singer Marco Borsato came to visit Aurelia. That evening Aurelia had dinner with friends. They laughed, drank, and toasted. And on the morning of January 26th, she wrote the last post on social networks. "I'm going on my way. Thanks for everything. Now I'm unavailable." The documentary includes Aurelia's last conversation with journalist Sander Paulus. In her hands, the girl holds a small bottle with a deadly poison. When asked if she has changed her mind, Aurelia answers, "No doubt. I'm ready to hit the road." The death of Aurelia Brouwers caused a wide public outcry in the Netherlands and made headlines around the world. People wondered if a law on euthanasia was adopted for such patients. And now we will never know whether Aurelia's desire to die was one of the symptoms of her mental disorder, or a deliberate decision. It is worth noting the words of Alexander Semennikov, a member of the Association of Lawyers of Russia. It seems to me that when the right to choose is given to a 17-year-old person, it's over the edge. No matter how well a child is developed, he does not have a completely complete idea of life. He still has the formation of personality, skills, character, stress resistance. When the personality structure is still being built, it is impossible to let such a novice architect blow up the foundation under his structure.